We live in a day and age where technology is creating a world without borders, filled with unlimited potential to improve the lives of the people around us.
We're gonna do awesome. So we're gonna do a telemedicine section. Okay, get the supplies ready. We'll get the cartridges ready. We'll get a kit ready.
Innovarx Global Health ushers in a new way of leveling the playing field with increased access to quality healthcare services delivered at your doorstep. Our qualified professionals are equipped with state-of-the-art point-of-care testing technology to conduct tests such as kidney function, liver function, electrolyte tests, body composition, hemoglobin, A1C, and many more services with the highest efficiency in delivering results.
Hi, Kumba. Our nurse team got it from here. Guys, could we go ahead and take her vital, her blood pressure, and her blood sugar?
With our proprietary cloud-based electronic health record system, Agasta, our telemedicine services now allow for a fully integrated health system that provides a personalized medical encounter, removing access barriers, fostering continuity of care, and providing positive health outcomes. Our local and international doctors can formulate treatment plans executed by our highly skilled nurses while leveraging the expertise of highly trained doctors of pharmacy to optimize medication therapy. The addition to our flagship Wellness on Wheels, more fondly known as WOW Delivery Service, brings the entire clinical experience full circle to ensure our patients receive the best care to rapidly improve their quality of life. Since its inception in 2015, IGH has remained committed to creating the future of healthcare delivery in the West African sub-region and other parts of the continent. Gone are the days of sending loved ones outside the country for basic medical services due to a lack of facilities. Innovarx Global Health offers a new peace of mind and takes pride in delivering the quality of care we all deserve.
Meanwhile, while doctor is working on that, I would just want to urge all of us to begin this tonight's webinar with prayers. We urge everyone to pray in our own way for Allah the Almighty to guide us through this event tonight and make it a success. Bismillah. Proper?
Sure.
Good, thank you very much. We have done prayers. I am sure you have also been part of the prayers. Now the next on the agenda is to call on to introduce ourselves, Tonight, I will be your co-host, and I have a co-host with me here. So
I am Aminata.
Exactly, that is the co-host, and my name is Abdullah Njai, a final year student in Marwadi University, pursuing Bachelor of Science in Information Technology. We'll be driving you tonight with Doctor and issues regards to health and pharmacy in the Gambia. Aminata?
My name is Aminata Sanyang, a final year student in Innovarx Technological University, pursuing mechanical engineering.
Thank you. Thank you very much, Madam Sanyang. I would now welcome or invite the president of the Gambian Students Association of Gambian Students in India to do the opening remarks on behalf of the students of Gambia in India. Thank you, Mr. President. Welcome.
Yes. Thank you so very much, Mr. Njai. Am I audible?
Yes, you are.
Yeah, Ms. Sanjay, maybe if you can now remove your screen. Let me see. Okay. Thank you so very much, Ms. Sanjay. Greetings, everyone, and greetings to our guest, Mr. Dr. Badjie, and thank you so very much for honoring our invitation. And as I say, like, a special welcome to our distinguished guest there, that is Dr. Ismail D. Badjie. I am Ibrahim Mbow, the president of the Association of Gambian Students in India. It is both an honor and a privilege to welcome you all to another edition of our Gam-Ind monthly webinar. This session is particularly special as it marks the first webinar of 2025, and we are excited to begin the year with such a prominent figure in the health sector, that is Dr. Badjie. Dr. Badjie, it is truly a pleasure to have you with us today. Your presence not only inspired us, but also adds immense value to our platform. I am confident that today's webinar will be one of the most impactful and engaging events ever organized by our association. To all attendees here, thank you for joining us, and to you, Dr. Badjie, we extend our heartfelt gratitude for accepting our invitation and dedicating your valuable time to share your insights and experience with us. We are deeply grateful. Thank you so very much for your time and everything. That being said, I thank you all for being here and wish you all a joyous, and a successful webinar. Thank you. Mr.
Thank
Jai, back
you.
to you.
Thank you very much, Mr. President. Thank you very much. And I mean to those prayers. May Allah the Almighty accept all this. Before moving to the next, I would want to acknowledge the presence of some key important individuals here. One, Mr. Sanyang, all the way from Bangladesh, and our former president, Madam Adam Abba, Ms. Fatu Man, and many others that have joined us, former students that are currently in the Gambia still here with us tonight. So I want to recognize the presence of all of you and say thank you very much for joining this tonight event, because knowing Dr. Badjie, meaning you know what we definitely expect. That is why I know all of you join, most especially those in the health sector, pharmacy students, microbiology, as well as nursing students are all here tonight. And I'm sure they are ready with their questions, Mr. Badjie. Now, next on the agenda, I would invite my co-host to give us an intro about who our guest tonight is. Madam Sanyang, over to you.
Yes. Good evening, everyone, and welcome to today's webinar on the prospect and challenges of healthcare and pharmacies in the Gambia. My name is Aminata Sanyang, and I'm thrilled to be your co-host for this important discussion. Healthcare and pharmacy are the cornerstones of any nation well-being in the Gambia. The challenges and opportunities in these sectors demand our collective attention, from improving access to healthcare in rural areas to embracing innovation and technology. There is a lot to explore today. We are joined by an incredible panel of experts who bring diverse perspectives and deep insight into the healthcare and pharmacy landscape. Thank you for taking the time to join us in this critical dialogue. We encourage you to share your thoughts and questions. Without further ado, I will take you through his biography. Our special guest tonight is a distinguished pharmacist, visionary entrepreneur, and trailblazer in healthcare innovation. With over a decade of transformative leadership in community healthcare and pharmaceutical distribution, a U.S. Lansing pharmacist and certified Six Sigma Green Belt, he has expertly led high-volume, multi-million dollar pharmacy operation, excelling in inventory optimization, medication therapy management, and the development of impactful community health initiatives. His professional journey reflects a unique blend of global expertise and localized impact, from managing 24 hours community pharmacies across the United States to spearheading ground-speaking healthcare solution in Africa. He has consistently redefined excellence in healthcare delivery. As the founder and CEO of Innovarx Global Health, he has revolutionized health access in the Gambia and neighboring regions by introducing an an integrated, community-based model that emphasizes preventive care and affordability. Our guest holds a Doctor of Pharmacy degree from Purdue University and has further honed his entrepreneurial acumen as a participant in the prestigious Stanford Seed Transformation Program. His work is a testament to his unwavering commitment to bridging the gap between diaspora expertise and local healthcare challenges. With a mission to transform healthcare delivery in sub-Saharan Africa through accessible, affordable, and innovative, patient-centered healthcare. Innovarx Global Health, IGH, was born out of the founder's vision for a Gambia where access to quality health care was not a privilege but a right for all. A Gambia where people continuously invest in their health through regular screening and increased awareness, for it is our most valuable form of wealth. Through his innovative leadership and passion for global health equity, he is reshaping the pharmaceutical and healthcare industry in developing markets. His effort continue to inspire change, foster resilience, and build sustainable healthcare systems that improve lives across continents. Ladies and gentlemen, please join me in welcoming Dr. Ismail Badjie. Mr. Badjie, the floor is yours.
Thank you so much, Amina. Good afternoon to all of you guys. I'll repeat what I mentioned earlier in terms of apologies for the late start with the technical difficulties I had. But it also dawned on me that I need to send a shorter bio, and I think it's a good place to start our conversation because oftentimes, as some of you guys are students, I think it's important that I mention that who you are is going to evolve with new knowledge, new life experiences. What you do is going to change. You could be a pharmacist today, you could go into business, you could be a carpenter and decide to be an electrician tomorrow. But why you exist and why you associate yourself with building and solving problems is one of the most existential questions. Every single human being on earth has a why. That's the foundation of everything that we're going to talk about today. So if there's anything I want you to keep in mind, I like putting things that you put a bow around. Everything that I mentioned, start with why. Think about why is that? Why is that? Why is that? Because oftentimes to find the solutions that we have, be it in healthcare, technology, agriculture, you ask why 5 times, you get closer to the root cause, right? And the beauty about healthcare is, and I have some things that I'll share with you guys just from an understanding of healthcare, but I'm going to assume that none of you guys understand healthcare at every single level, or some people may be pharmacists. And let me see if I have access to share, because I think it'll do our conversation really well. And let me know if you guys see my slide. Let's see. Do you guys see this?
Yeah, sure.
Okay. So it's nice and beautiful. You guys see what I'm seeing, the problem we see, correct? Could I get a verbal confirmation?
Very well, yes, sir. We are seeing it loud and clear.
Yes.
It's very clear. Thank you.
So most people are visual learners, but I'll give you a brief background of who I am. But I always find out that why I am is way more important than who I am. Yes, I am Gambian. I went to school in Gambia from between the ages of 7 to 17 at the time. So I did Mrs. Knowles. I then went to Gambia High School, where I graduated in 2003. I think that's one of the most significant periods in my life, was in high school, in Gambia High School. I was a science student at the time. In retrospect, I am not a fan of that aspect where I only learned science in high school, because I wish I was exposed to literature. I wish I was exposed to economics. I wish I was exposed to accounting. But, I was a science student, and I left Gambia High and I pursued my first degree in chemistry. But I tell individuals that I left Gambia to go to university as a civil engineer student, right? Goes back to start with why. 2 weeks into my classes as an engineer, I realized that, okay, I was finding difficulty to see my why, also to understand why am I passionate about this. I think just engineer sounded really good to my dad. And I know most of us, our parents' aspirations sometimes permeates through what we want. And I realized that, okay, I like chemistry in a way that is very intimate. And most people don't like chemistry because I like understanding the mixtures, how things work. I think anybody who's a science nerd, which I still am at heart, the idea that something as simple as you could take something and like an acid and a base, which is corrosive, you bring it together and it creates salt and water. That to me has always been the most fascinating phenomenon about the world that we exist. But also for some of you guys that have a relationship with God, it's most chemistry is God's flex. God tells us how magnificent he is by chemistry, as in I could take something and something else and bring it together. And we're all made up of chemistry, from carbon, from all the elements that we need, the right amount of oxygen in the air. So I've always been fascinated by that. So I think that influenced my first decision to be a chemist. And that was a degree I had in undergrad. I had a bachelor's degree in chemistry. But as you guys know, there's always something you put on top of it. So after my chemistry journey, the typical options at the time for me was medical school, pharmacy school, dental school, or go the PhD route. So I explored and experimented. And I think it's always good to get exposure. Let me go and find somebody who is doing something that I think I want to do and see if I see myself doing that for 30 years. It's so important because oftentimes the world forces us, young people, to make lifelong commitments at the age of 18, 19, 20. So for anybody who's on the call, the one thing I want you to realize is you have so much time. Where you start is not where you're going to finish, but always be curious. Always listen to that inside voice of yours that tells you, look closer here, that tells you, walk away from this. And then eventually you'll stumble through life in a very imperfect way. And I guarantee you'll land where you see a problem that upsets you enough that now you want to accumulate knowledge to find solutions for, right? At the end of the day, I think what drew me to healthcare, what drew me to pharmacy was once I started realizing my relationship with the world, why my grandmothers were not around, me living in the USA, Gambia, somebody dies at 56 years old and it's normal now. And based on, and all those things. And then we move on, where in the USA, somebody dying at 56, they're like, no, that person is actually too young to die at 56, because that means they didn't get a chance to see their grandparents, they didn't get a chance to see their kids get married, have these life amazing things. So that to me was a problem. So my healthcare journey, my pharmacy journey started that way. My mom was a trader. I grew up in a household where my mom had a retail store. She was selling female clothes. So that's where I started understanding business, relationship with customers. I remember seeing how, some of the women felt when they had saved up enough to buy that purse or that dress right before Eid. And as you guys know, that day of Eid pictures, especially in this day and age, they did not have social media where it's hashtag Since Gambia 2020. But just the fact that they had earned and saved hard-earned money and bought something that they want, I used to see that in my mom's store and saw the value of not only human relationships, but self-aspiration, but also just people, dealing with people in terms of commerce. So that's where my journey comes from. My parents are not in the medical field. I have no family member who's a doctor, nurse. I'm the first healthcare professional in my family. And if you understand the different fields of the healthcare environment, pharmacy to me represented the marriage between medicine and the community, the marriage between medicine and commerce. But the marriage between medicine and really understanding the plight of human beings, because most decisions are made at the counter if somebody is not ill, right? So that took me to a path where I went and got a doctor of pharmacy. I spent the first 10 years of my career practicing in communities. I worked in HIV in the US health communities. And I worked in a lot of communities where every single day when I wore my white coat, I went to a top 10 program in the USA. You know, I had this high esteemed job, but I showed up to work and I was serving people that did not look like me. People that reminded me that my grandmother died at 56, right? And I think I keep mentioning that because that's the genesis of our problems. Most of the times, personal pain could be the spark for global success. If you think about it, where losing somebody that you love, I came to visit Gambia in 2011 and I saw what it was in the USA and what it is in the Gambia. And I'm like, wait a minute, we're just as talented. There's nothing anybody else in the world could do that we cannot do. We have bright minds. We just need an opportunity to find a solution. But I can't talk about healthcare without talking about myself, that I've been a patient since I've been 28. Most people do not know, I don't hide it though, I have been hypertensive since the age of 28, because there's a pattern. If your grandmother dies at 56 from hypertension, your mother is living with hypertension and diabetes, you have a high likelihood of having a chronic condition that you're going to live with for the rest of your life. So now that I'm 39, for over 10 years, every single day I've been dealing with a reminder that if I am not proactive about my health, something will happen. And more than likely, statistically, men in our family do not celebrate 60 years old, right? So this is very important. And it goes back to show that what you guys are going through in your personal journeys is leading you towards a career and a profession that you won't do it for the money. Because what? Start with why. Start with why is not even something I came up with. There's a really good mind called Simon Sinek. He writes books, he's on the internet. He explains the reason of understanding why. So healthcare, Innovarx, me deciding to move back to Gambia, started in 1992 without me knowing it, and then realizing that I can't change the world. Healthcare is very complicated, but how can I take knowledge that I've accumulated over the years, you know, and going back to say, there's nothing wrong with, you know, serving people that don't look like us, but as a human being, as an African, as a Gambian, it's something in me that every single day, this is Miss Ledford, amazing white lady, she'll bake me pineapple cakes, she'll come, you know, we had an amazing relationship because I was working in a very small rural town in North Carolina. But it always reminded me that this person is probably 20 years older than what my grandmother was when she died. So that's really where the spark began. And once again, like, God puts ideas in our mind for a reason. All of us have something that we could impact. Even if you're not creating it, you could sustain it. Even if you're not creating it, you could add value to it. But that's where the journey of healthcare began. But it comes back to a problem. And all of this, you'll see pharmacy, you'll see nurses, you'll see physicians. How I see healthcare, this is the problem I see. This is not a Gambia problem. This is an Africa problem. This is a global problem. Any ecosystem that you have a fragmented healthcare system, you're wasting time, money, and information is always missing. And a lot of you guys are on the path of not only self-actualization, but becoming contributing members of society. I want you to start seeing things through the lens of, what problem do I see? So I picture a person in Gambia who is 35 years old. He wakes up one day and then they don't feel okay, right? Which is always where most people's healthcare journey begins. I don't feel well. Here you have to go to multiple places. You go to the doctor, they write you a prescription for a lab. You go to the lab, they write it on a piece of paper, you go back to the doctor. The doctor says, oh, I think I need more information, but all physicians do is working based on information that is available to them. They say, you know what, let me send you to get an x-ray. You go to the x-ray, you come back. So imagine by the time you actually find out what is wrong with you, you're tired, you're frustrated, and you're broke. So any one of those push factors could just stop it. Or if you wake up one day and you're not symptomatic, meaning you have nothing bothering you in your body, your healthcare journey ends there, right? So I think it's so important sometimes for us to realize that healthcare, so if I'm a nurse, I'm seeing the opportunities and the problem. It's the engine of waste, right? And there's no blame. We're not going to blame nobody else. It's the system that we have. Meaning where you see a problem, somebody who is a builder, somebody who assesses how could we build the healthiest nation in Gambia, you start thinking about the problems, right? But you also understand in terms of how healthcare works. The human toll, majority of the population are reactive to healthcare. And some of us on the call, you may think you're young enough. Remember, I was 28 years old when I was diagnosed with hypertension. For 10 years, I've been taking blood pressure medication. I don't want my kidneys to fail. I don't want to have a stroke. So I'm playing defense, right? So if you see healthcare, I see it as the funnel of life. That's why I call this. The moment we're born, we're at the top of the funnel, we're young, our knees are fine, we're running, jumping, eating all the sugar, nothing happens. Every single human being is somewhere in this funnel. Either you're healthy, you just need primary care, or you have an ailment like hypertension like I do, I'm in the yellow zone. People that wait too late oftentimes end up in the orange zone, where now you need advanced care, you need advanced diagnostics, and then unfortunately you end up being 56 years old who passes away and doesn't get to know their family member, right? Everything around healthcare, if you look at this, you understand how healthcare systems are built in terms of primary at the top for the majority. You try to keep people in the yellow and prevent them from early death and hospitalizations, right? The lower you go, the more expensive healthcare is. And all of you guys have life stories. Every single person has a human story that you could relate to somebody who either started their journey too late, and by the time we found out something was wrong, they needed to be in the hospital, and then the family is mobilizing funds. They're bringing up, or bill may go to like $50,000. They pay for it, and then a week later, their loved one is gone. That $50,000, it could have been an investment in a business. It could have built land. So not only are you losing somebody that you value too soon, there's a financial cost where healthcare problems could bankrupt families just because the system is not designed the right way. And this is not an Innovarx model. This is just what we see. This is what guides us. But if you look at healthcare, pharmacy, I'll come to the pharmacy bit as well too, because once again, I consider myself a healthcare professional, not a pharmacist. Pharmacist is just a tool. Medications are just a tool. It's just one of the things that you could do, but there's other things that you could do. Even Innovarx, most of the times people think Innovarx is a pharmacy. And I'm like, no, the pharmacy is just part of the machine, because most treatments cannot happen without prescription medication, right? Very important, right? And then you think about it in terms of, okay, if you know that there's this problem, how do we create value in our societies around healthcare that does two things? How do we build a safety net that encourages and removes barriers to accessing healthcare as early as possible to prevent as little as possible people passing away too soon or ending in hospitalization? That's literally any healthcare system that you see. You could figure out what exactly are they trying to do. Are they focusing on the green zone? Are they focusing on the orange zone? Are they focusing on the red zone, right? You as an individual, where do I fit on this scale, right? When it comes to healthcare, what opportunities exist when I'm done with my professional career? And you remember, these organizations, companies, like, we don't only need healthcare professionals. There's so many aspects to our company that are involved in delivering care. But at the root of it, we just figure out, and I'm going to stop sharing so that I could start seeing faces again, right? At the root of it, it's what's the problem that we have, right? Okay, problem, Gambia, Africa. I want to remind you guys, every single person is an asset for Africa, not Gambia. Gambia has 2.5 million people. Africa pretty soon will have 2.5 billion people, right? Abdullahi, Fatu, Lamin, Amina, Aisha, all of you guys, Booba, what you are doing, what God is gifting you with as a responsibility, you could do it anywhere in the healthcare space, which is why oftentimes we lose a lot of talent in the Gambia because wages are low. Healthcare professionals travel for greener pastures, which is nothing wrong with that because all of us have families to feed and you should want to earn more, and you don't spend 28 years learning in school and then you come out and just not get rewarded for the value that you're creating, even though it's better if that value is created in our country, right? So that's the healthcare challenges, opportunities in a nutshell, right? How do you assess how we could give as many people as possible access to early and continuous healthcare? And how do practitioners, people that are in the business, realize that we all have a role to play to minimize individuals that get hospitalized, minimize people that die early? Because early death is just not passing away. It affects our families, it's breaking down our society. But also now we're seeing that there's not a lot of companies where the typical way is when it's too late, they have to ship them abroad or you have to go to Dakar. So as Gambian patriots or even Africans who choose Gambia to work, which I think we should always see, any Black person in the world who wants to build in Gambia is one of us because none of us is really truly Gambian. I don't think there's any Gambian that has 4 ancestors back that has a Gambian passport. So keep that in mind. We all migrated and ended up in Gambia, but it's just providing value, understanding how healthcare works, but also understanding the great opportunity Gambia has to become the healthiest country in Africa. I often say that people think it's hyperbole. It is not. 65% of our population is under 25. We just need 10 to 20 years of focused energy on increasing access from Banjul to Basse, making sure everybody gets early and continuous health care. And most young people, if you equip them with knowledge on how to stay healthy, if you equip them on access to a doctor, you know, for a woman that go through the OBGYN system, access to those services, 9 times out of 10, you're gonna minimize the amount of people that are sick. But also our hospitals are gonna be less crowded, so meaning resources could be allocated. But also for people like us, you'll have nurses all over that are now working for private companies that are providing healthcare services, that are reaching people where they are, providing medications that people know it's affordable and it's safe, right? So I think that's a good segue to transition to the healthcare bit, because parts of it I like for you guys to have asked specific questions, which I could dive on. But I want you guys to always remember that funnel of life. That funnel of life is always one of the most important things to measure based on all our interactions and relationships with healthcare. One, where do you stand there? Are you in the green? How do you know? Especially for our men, we think we're bulletproof. If something is not bleeding, if something is not broken, if something is not burning, the African man does not seek healthcare until the pipes start going bad or something is happening, and then they run to the healthcare systems and it's too late, right? Most women are more proactive about their health, but also women work in communities better than men. And I say that from a healthcare standpoint is women will talk about health issues amongst each other. They have a better relationship with sisterhood, talking to each other. Men will talk about the Arsenal football game, the Manchester football game. They'll talk about all these things, but they don't talk about, Abdullah, I'm going to check my blood pressure. Let's go together and check my blood pressure. Hey, do you know that my dad is going through prostate cancer? Do you know that X, Y, and Z? We're not proactively engaging each other about healthcare. So there's also a disparity. So anytime they say Gambian women are living longer than Gambian men, it's most of the times because they have a healthier and more proactive relationship with their healthcare, where most men do not. And I just like explaining that psychological difference between the two, right? Healthcare revolves around challenges. It revolves around how early could you find out somebody's health status, whatever the outcome is, accepting the reality like I did when I was 28 years old. There's very few 28-year-old Gambian men I know that would walk into a doctor's office. They tell him, Musa, you have hypertension, and it's not like you take 5 days of antibiotics and it goes away. Now you have to take one medication every single day for the rest of your life. Because even if you do lifestyle modifications like diet, exercise, you are now having to play defense about something that could lead to early death. Gone are the days where a lot of Gambians are dying from malaria and all these tropical diseases because advancement in science have made that easy. I could give you guys some insights in terms of our company. As you guys know, we believe in data. We run very sophisticated electronic health record systems. We've been accumulating, going into communities and screening people for over 5 years in Gambia, right? 4 out of 10 Gambian adults in the country have a chronic condition that requires at least one medication a day for the rest of their life to prevent early death and hospitalization. These are not assumptions. We literally have the data showing that those figures, meaning for every 10 Gambian adults that you see, and some of them are our mothers, some of them are our fathers, some of them are our uncles. I guarantee you, any one of you guys, especially some of the nursing students, when you come back home, do an experiment. Buy a blood pressure machine. Hell, if you come to Innovarx, I will give you a blood pressure machine. Go into your communities and just screen people for their blood pressure. 4 out of 10 adults more than likely don't have a normal blood pressure, right? So understanding that shows you that we have a wide variety of individuals that need not Band-Aid malaria care. There's a joke that we treat all health conditions in Gambia like malaria. Yarambitangana, maloman pesia, ngadem. You don't even see a doctor. You drink it 2-3 days, the fever goes away, you're perfectly fine. That's how everybody consumes healthcare. Like, if you don't feel something, you don't do anything, right? So if you have a condition like diabetes or hypertension, right? And I'm gonna tell you guys a personal story because we're getting ready to post something on our social media about what happened to me this morning. Because I've been hypertension, I've been going through a lot of stress. I did not take my medications intentionally yesterday. And I just went to check my blood pressure this morning and it was very elevated because I've been hypertensive, meaning any day that I do not take my medications, I am walking around as a ticking time bomb. That's why most of the times, no. He was walking around with his blood pressure so elevated that he had a stroke and just died. He did not die that day. He died the day he made a decision to not seek care if he did not know, or he went so long because of our fragmented healthcare system and did not capture his healthcare moment as early as possible. So this is a more collective thing. It's very, very important, which is why people sometimes pay too much attention in terms of the pharmaceutical sector. Because I'm gonna say something, and I mean this properly. Most of us Africans see the pharmaceutical sector as a commercial enterprise and not a clinical enterprise. Most of Africa, including our laws, our regulators, the system is designed to control the commercialization of medications as a commodity. No difference than putty mill, no difference than a lot of these commercialized products. It's not based on a clinical experience, meaning how do we ensure that every Gambian has access to the right medication at the right time? And when you drink medication in the Gambia, you have to wonder, is this fake or is it not? Because 40 to 50% of the medications in sub-Saharan Africa will not pass quality control in a European nation. Meaning buying medicine, especially in places where you don't have access to a pharmacist, is a coin flip. So imagine what that does to somebody's grandmother, who every single day religiously, they wake up Fajr, they're gonna drink their medication. But they have to send the little boy in that compound every single day to the pharmacy to buy medication, right? So she's taking medication religiously every single day, and then not knowing that the medication that she's taking is not quality medication. So meaning, from a clinical standpoint, if she has blood pressure, her blood pressure is not going down. If she has blood sugar, she's getting sicker. So the psychology of that grandmother is like, this white man medicine doesn't work. Let me go back to the herbs. So she just stopped seeking clinical treatment altogether. And next thing you know, she's down that same funnel, yellow and red. What killed that grandmother wasn't because she was a bad patient. She was taking her medications every single day, religiously after Fajr. What killed that medication was she was born in the wrong country, because if she was in America, there is not a single day an American person takes medication and puts them in their mouth, and they have to think, is this quality? I know this because I spent 10 years doing it. My bio tells you that at some point I was dispensing 1,000 prescriptions a day just for one community as well. You don't think about whether this medication is going to work or not. But in Africa, because pharmacy is a commercialized entity, we are exposed to the most amount of fake medications than anywhere in the country, and we have to ask our questions, why? It's not only medicine, it's food. It's not only food, any product for consumption that is low grade, if you want to find it, come to Africa. Why is that? Products that you cannot even sell in where they're coming from, they bring it to Africa. Because at the end of the day, we haven't reached a collective mass of guardians of our country, where we put purpose before profits, where we think about that grandmother who wakes up every single day at Fajr to drink that medication, and then you still have to attend her funeral, and the son or daughter may not be in the country to witness it. So people think healthcare is not a joke. The pharmaceutical sector is one of the most important sectors in our nation. But people think Gambia only faced a tragedy a few years ago with the kids that died. Every single day, people are dying because of substandard medications in this country. So the task at hand, I hate talking about the pharmaceutical sector because it's not a secret that what feels like a jihad that I have been on. I've been educating people. When we bring medications, we care more about, not because they sell it in America. We just have a fundamental principle. Even if Joe Biden has hypertension and he's taking a medication, I want that grandmother who's praying Fajr in the morning to have access to the same medicine that Joe Biden, the president of America, has. Because that is equity, not equality, health equity. The right to right medication, right healthcare as a human right. Nobody else is going to protect that except us as Black people on the continent. So it's not even about business. Most people think it's a commercial enterprise. Some of you guys will run businesses. Businesses exist to create value and solve problems. People are trading money for value. The money is not designed to enrich yourself. It's designed to build your business bigger so that you could serve more people. And you always serve two kinds of people. You serve people internally in your company, and you serve people externally. So the bigger Innovarx goes, we had at some point up to 75 employees. Last year, the employee number came down. Why? Not because our business was bad, because the business started struggling because of the environment that was in, and it's money. If the math is not mathing, you can't be in business, right? So the more people you have to serve, remember that 4 out of 10 Gambian adults that I mentioned, meaning Gambia has 366,000 Gambians where every single month we need to make sure they have access to the right medication that is quality. If not, there will be a statistic, meaning they're going to die before the age of 65, right? So it starts from there. Money as a business, the more money you get, the more you invest in your business. Now you start training more healthcare professionals. Some of you guys that are nurses, going to be pharmacists. You don't have to come and try to build a system. You could come and be a part of a system and become a multiplier. You could go to any Gambian-owned healthcare company, and not all of us have to own companies because that's difficult. You have to have a lot of different things work for you. But remember that the problem is going to be bigger. So the pharmaceutical sector, the way I speak about it is, only we could change our pharmaceutical sector. Only we could decide that, hey, this that I'm getting, let me just get 20% profit and not 300% profit. Hey, this, let me make sure that the medications that I'm bringing in this country, my mom will take it and I will go to bed at night. Or Amina will come and buy it for her mom and I could sleep at night because Amina would know me the next day. And she'll always know that, Ismail sold me this medication and now my mom, something happened. So whatever we do, be it healthcare, be it commerce, be it pharmacy, we have to have an enlightened conscience as business. Even people that are fans of capitalism or not, capitalism is not bad. Conscious capitalism is important. The pharmaceutical sector is lacking conscious capitalism. And it's not a knock about anything. And let me tell you guys something, because you guys are in India. I had the privilege of visiting India because at the time, my father was the Gambian ambassador in India. Most people, I understand India and I have a passion for India, and because I understand the plight of students in India. I know what their journey looks like, right? I love New Delhi. When those kids died in Gambia, people started calling India as if India don't make quality medications. I'm gonna tell you a secret. Over 50% of the medications in the USA are manufactured in India. India is known as the world's pharmacy, right? The world's pharmacy, not for India. The highest grade of medications are developed in that country, right? Even Gambia today, the moment you tell somebody this medication is made from India, they say, no, that's not the case. That's not the case. We need to ask ourselves, it's not who's buying it, who's bringing it into the country, what is the intention, not India or any country in the world. But I think it's very important because you guys are living in India, and I believe that the conversation, the general public did not understand the dynamics. The day India closes its doors, there will be a pharmaceutical crisis around the world, right? I want you guys to remember that. When it comes to pharmaceutical production, they are the top of the class, to a point where even Americans have said, you know what? India is doing it better. But the one thing about India, in terms of like anywhere in the world, so I just want to mention that as well too, because you cannot talk about pharmacy without talking about the Indian health ecosystem. It's impossible. They're tied together. If there's a drug shortage in India, it's going to affect the entire world, right? So the pharmaceutical sector has opportunities, but oftentimes we focus on the commercialization aspect of medicine, trading, commodity trading. When I hear pharmacy, I hear pharmacy practice. As in, are you qualified where if Isotech comes to the place where medications are sold, you could not tell her what's right with the medication, you could tell her what's wrong with the medication. If she has a child, you just don't tell her, Jokobena Kudu. What do you mean Jokobena Kudu? Children's medications, you need to have the weight of the child. How heavy is your child? That way you dose it accurately to make sure something is safe and effective. So pharmacy is tied in understanding medicine knowledge, where now once the physician, and I'm going to speak as I end to connect the dots. Every physician works on information. There is no such thing as a good doctor. You measure a good doctor based on their interpersonal skills, the same way you measure any healthcare professional. Are they compassionate? Are they a good listener? Do they fight for the patient? That has nothing to do how much anatomy or physiology or pharmacology they know. I assess good healthcare professional based on their level of empathy, right? Dignity, share. I'm telling you guys something. Healthcare, if you work in healthcare, how you make somebody feel is better medicine than any pharmaceutical product. Because you see them, you feel their pain, you understand that this person is struggling with a patient, because anybody who's seeking healthcare is not there to buy something that is pleasurable or for entertainment. Something is not well. Physicians work on good information. Do you have access to the most information about a patient sitting across from you to make an assumption, or you arrive at a decision, which is a diagnosis? The nurse is in charge of giving you as much information as possible, be it the vitals, be it the psychosocial aspects. All is data. And it goes back to what you waste: time, money, and information. If you have all the information, that's why with artificial intelligence, that's why it's going to change healthcare. But also artificial intelligence, the one thing about healthcare that it cannot change, a robot can never make you feel how a good healthcare professional will make you feel. They will be better at processing information to arrive at a more accurate destination. They will never perfect being a human being because Allah gave that to us to relate to each other, that no machine on this earth could never make you feel human emotion. So they will improve our access to data. We'll get better diagnostics. The medication therapy will be more accurate. So when people ask me, where is the future of healthcare professionals? Would AI change? No. You need to use AI to be better at getting it right. Reduce human error. That means as healthcare professionals, you need to be better at human beings, having empathy, having compassion, going the extra mile. So all of that is data. So when they arrive at the data, arrive at a prescription. That's where pharmacy practice comes into play, because we are guardians of safety and effectiveness of medications. I mentioned nothing about cost because it's not a commercial enterprise. Only in Africa do we think pharmacy, it's destroying our relationship with medications. So as a pharmacist now, if you come, I could assess, okay, who are you? Why are you taking this medication? Is the direction right? Is the diagnosis correct? And then this is what we are going to try to see if we could chase data, as in we're measuring blood pressure. So if Ismail shows up at 28 with hypertension, they confirm, they do multiple tests, my blood pressure is always high, they do a family history, they realize that my mom had it, my dad had it, my grandmother had it. They arrive at a diagnosis. So they start my treatment with lisinopril 20 milligrams, which is a common blood pressure medication. That is not where my treatment is supposed to end. And it goes back to the fragmented system. That's where my healthcare journey begins. So going back to quality medication, going back to access to it, if my blood pressure is 156/106 and you introduce something that is foreign into my body every single day, what should happen is my blood pressure will go down. If it does not go down, two things happen. Bad medication, or my choices, I am not taking the medication. So there has to be a continuity with building relationships with patients. But going back where I began, if I come 2-3 days, blood pressure is not going, I may never see the doctor who told me I had hypertension until I meet him at the hospital after I had a stroke, because there's a severance of that journey, right? So everything is interrelated. But when it comes to healthcare, that's why concepts like collaborative practice, where Innovarx, if you come to Innovarx, a physician is working with a doctor of pharmacy, is working with a nutritionist, working with a physiotherapist, because you treat the whole body, you treat the mind, because a lot of things are also psychological. Some people have something they call white coat hypertension. Anytime they see somebody with a white coat, their blood pressure goes up, but they actually don't have hypertension. Some people deal with anxiety. Some people are afraid of blood. There's just so many aspects that we need to do. So that, in a nutshell, is hopefully a top-level overview of how healthcare should be looked at. But also, Pungen Gisis and Bopa, you see an avenue where it comes back to why. Why do you feel passionate about a problem? Will inspire you to seek knowledge, seek experience, reach out to people like myself. Not to tell you what's wrong with our society, because if not, I won't be an entrepreneur. Is our society perfect? No. Is the health system perfect? It's never been perfect. Gambia has never had a history of a good healthcare system. So it's actually better today than it was, no matter how bad. But better on Gambian standards is not better on global standards. And we need to start competing on global standards, because once again, if Joe Biden is getting treated for hypertension one way, our grandmothers deserve that same level of treatment. And that's what my why is rooted in. So I thank you guys, and I'll welcome opportunities for questions as well.
Wow. I must say this, the Association of Gambian Students through the executive did not make any mistake by starting this 2025 with Doctor. To be honest, like you said, Doctor never runs out of words, but I really agree that Dr. Badjie never runs out of words. This is really important. I think we have learned a lot And I must say this, that our pharmacy students market, pharmacy is not beginner. So please, those studying pharmacy should definitely note that as well. Thank you very much. I think we'll move into the next session of this webinar, that is the question and answer session. But before that, Mr. Badjie, Mr. Badjie, I would definitely want to seize this opportunity again to wish you a happy 10-year anniversary. I believe, if my math is correct, this was established since 2015. And I think the Association of Gambian Students are the first to celebrate with you and your company.
Yes.
Yes,
success, thank you.
The success. And I also have to say this, you're bringing health system in a different way, digitalizing it. And I've accessed to your system, that is this Avasta. It's a great system because data is important in health. And not only that, again, what interesting things I like about Innovarx is this service that is digitalized, like offering service in your home, in your doorsteps. I know government is doing a lot, but Innovarx is the one that will find you in your home, in your bed, and offer you service. That is definitely something very welcoming, and I definitely would applaud that. And the Association of Gambian Students are really happy to have someone, a young and dynamic Gambian, that definitely is offering this. This will lead us to say that health service is not only to do with government business, it's everyone's business. Health is everyone. Like you said, who feels it knows it, because you've been diagnosed this for 10 years now, and you're also suffering. That makes it different, I believe. That's why you're doing your utmost best, because you know what people are feeling. If I am being a doctor and I have never been diagnosed with anything, I might not care that much, but you know how people feel when they have attack, for instance. So I think that's why you're coming with difference and leaving US. And that will bring me to my first question before allowing people to come in. You are a young Gambian that left the US, that was definitely excelling, and come back to Gambia to build or start this kind of a business. The health system has been characterized in so many ways: corruption, no healthcare system is always poorly. You just made mention of it. What motivated you to come back? Is it because of the story that you made mention about your parents or your grandmother that has the same diabetes with your mom? Or is it because you had enough money and you definitely you're okay with the dollars you collected, you can come back and relax comfortably? Or it's just love and passion for the field and you really want to serve Gambians? Then I'll start by asking, what motivated you to come back? Because us as youths, most of us here would even want to go to US, even without completing our course. People are just thinking of traveling. No one wants to go to Gambia. So as a youth, and we have all youths around us here, I think all Gambian students in India are all youths and are listening. What motivated you to leave the US with the dollars and everything and come back to Gambia to serve, establish this business? Over to you.
But that's an excellent question. The biggest misconception about business or entrepreneurship is that you have to be wealthy and then you start a business. Because growing up, we only saw people who had money start a business. I think that's the biggest misconception, right? That it's why you started, because you're comfortable. It's because that's what we've seen for a very long time, right? And what we've seen in terms of diaspora returnees, the only ones that used to come home were the ones that were financially secure, the ones who had retirement savings. So when I tell people that I don't advise people to do what I did, because it's not, most of the times, it's not worth it to a lot of people. And what I'm going to tell you guys this as in, I don't advise people to do it, which is why entrepreneurship is a contract you sign between you and God. If you started for money, you're going to stop doing it. Any idea that you want to build, if you're doing it for money, you're going to stop doing it, because there is no reason to build in Gambia if money is what you're looking for. From a business standpoint, Gambia doesn't make sense. It's 2.5 million people. Our systems are structured really well. We still don't have that desire to see each other succeed, which is why we're speaking about the pharmaceutical sector. Can anybody name a multimillionaire who's become a multimillionaire in the pharmaceutical sector since 1965? That's Gambia. Can anybody name one? Gambians have been buying medicine the entire year. Do we know any multimillionaire in healthcare that is Gambian since 1965? That's Gambian? You don't, right? So when I saw that whatever I have in America, which is a good salary as a healthcare professional, yes, this is true. Some of you guys that are healthcare professionals, if you have an opportunity during your earning years to go to America to work and your family depends on you, go and make money for your family. Because sacrifice the M. So I'll be a hypocrite to tell people sacrifice, don't work for money. No, you should always be paid what you are worth as an individual. And the reality is any healthcare professional who chooses Gambia is sacrificing the most earning potential they will have in their life because they love nation or because something is calling them where it's tormenting them where no matter how much money you have in the USA, you will still wake up every day and not feel okay. So the decision that I made to quit my job after being in school for 28 years of my life, I was 28 years old when I was done with school, to decide that I could stay here and make up to $200,000 a year. One day of work in the USA for me is about $800 a day of work. And I have been in Gambia for 5 years building. So when I tell, and this is more not only about money, this is about entrepreneurship. Entrepreneurship is a spiritual journey. My father did not give me a business to run. My father did not give me money to run. I just am lucky enough to have a father and mother who does not rely on only me for their sustenance. So it's easy for me to walk away from money that is temporary because then I may opportunity to sacrifice of something that is bigger than me, right? So anytime I talk to people about coming back home, I know and recognize the opportunity I have. So if you are the breadwinner in your family, can say don't come back because you need to earn as much money there and get your house with your mom in a house that you want, put your mom in a car that you want, because you should be paid what you are worth. But for us that have the opportunity to come and build Gambia, because for me, I get upset that Gambians, they couldn't take it, we want to take it. When China was ready to change their country, they did not want to end poverty. They wanted to build prosperity. They didn't want to get people a good salary. They wanted to make people millionaires, right? So it's a shift, right? Not every diasporan can come home. But those of us that God has blessed us with the opportunity to be able to sacrifice, no matter how painful. Do I miss the money? Yes. Most people in Gambia, they see me, they see CEO Innovarx, they think I have money. Wallahi, there's some days that they have more money than I do. Right? I go years, I don't take salary. But I could sleep at night and say there's 50 Gambians, there's 75 Gambians where it may not be a lot of salary, but something we created is giving them an opportunity to earn a living, because I know that even if I don't bring money home, my parents are not gonna miss lunch. That is the right way to talk about my return home in a responsible way. But also that doesn't mean that all the sacrifices that I'm making, I'm also gonna exist in an ecosystem where we cannot win. Because wherever there's problems, 20 years from now, 30 years from now, people are going to win in Gambia. And I want to see Mamadou Fati, I want to see Aisha Minte, I want to see Fatou Mane to be millionaires in Gambia based on something that God gave them the gift to do, and they will share it with more people. So that's my philosophy, you know.
Thank you very much. Well, we must win. If you want to doubt that, ask MCA that wanted to stop you. You must win. Yes, as I said, we are getting into the question and answer session, and I am seeing many hands being raised here. I think we will have to summarize this a bit because I'm sure these people are really ready for you. You might also send your chats, your messages via the chat box if you feel like. I will start with Fatou Mane. Her hands was on since this inception. Miss Mane, are you here? Probably that would have been a mistake then. Okay. Yes, I will move on with the first one that raised hand was Mr. Ibrahim Mbo. Mr. Mbo, please, let's have your question then. Thank you.
Yes, am I audible?
Hello.
Hello.
Yes, you are.
And thank you, Dr. Badjie. Definitely really inspired us. Definitely, we are really inspired, definitely. So my question is like, this is from also an experience that I had in Parapanye General Hospital. That is the AFPRT General Hospital before. So what happened was one day, leaving for India, before I left for India, I took someone there. It was around late hours. So the nurse, I don't know how to call her. The one we met there, what she said was like, when she checked the guy and checked the blood pressure and other things, she said like, your blood pressure is this is this, like those things is this. And if someone have this, it's most likely like is come associated with something. So when that guy come out, he told me, look, brother, just on the bike we go. Because what this nurse is saying, like, it's not even clear. How can I risk my life for that? So on that note also, like, how can we trust the healthcare? As you really say, like, the person there or the one like offering the service, to be able to cure you yourself. So if that particular guy was not able to know or diagnose and tell you that this is what affect you or this is what you are facing. So us now, how can we trust that healthcare system? And after that also, my second question will be like the numerous institutions we have in the Gambia now. I can tell you this now, all the arts students, commerce students are into these nursing schools. You will know that you were someone in a class, that person was doing arts or commerce. At the end of the day, he did not even go to study some courses or did the test on some science courses. But at the end of the day, he or she is doing, nursing, and at the end of the day, he will end up at the hospital. How can we trust that system? Thank you so very much.
No, thank you, Ibrahim. And the last part, it's an economic issue, guys. If you notice how most parents tell you to go into healthcare, go demanganeka nurse, is because in their eyes, nurses equals stability. Nurses equals a good job. Nurses equals a profession that donyaka ligay. It's economical. So I don't fault people for finding economical reasons to choose a profession. I don't think you could love doing anything in healthcare if you don't have a true passion for it. But there's a lot of healthcare professionals that are healthcare professionals for economic reasons. I mean, and once again, everybody wants to feed their family. Gambia doesn't have a lot of opportunities. There's very few degrees that you could get that you at least could guarantee work and you'll be able to serve. So, and once again, just because you're a commerce student, I don't think that means you're bad at science. That's a colonial way of thinking about education. So yes, it's economical, right? But that nurse, you could be a commerce standpoint. It doesn't matter as much in terms of the experiences with healthcare. And I think somebody's mic is off. Let's see. I think I'm in a sign. Yeah, there you go. Thank you. In terms of the experience that you had, I tell people, one of the features about being an entrepreneur is you criticize by creating an alternative. I feel like for every not so good experience that you have at a facility, if you're in healthcare, try to see how it could be better. But for some of our nurses, going back to your value, some of our nurses in the Gambia or even healthcare professionals in the Gambia are the most underpaid and undervalued and hyper-stressed individuals. We're the only human beings. So oftentimes what you see as bad customer service is somebody who can make ends meet, who has to work Edward Francis the whole day and then go back and, work in the evening. They haven't seen their parents. Their marriage is in trouble because they're always working. Their kids are not being seen. There's a lot of human elements to us healthcare professionals that, the general public may not see. And if it's in Gambia, it's even harder. That's why I'm always kind when people say our nurses are rude, X, Y, and Z. Their lives are very difficult. And going back to value, that the only reason why you're just as tired, you're just as broke, you're just as, exhausted is the fact that you were born in Gambia and you happen to be a nurse in Gambia. Anywhere else, especially in the West, conditions would be better. Because we see the opposite. I think there's a direct correlation, be it a nurse or anywhere else. If the environment is right and you're a professional, you're going to give your best work. So I don't train my nurses on how to be human beings. I need to make sure the environment that they work in is conducive enough where they have psychological safety to be able to feel and be empathetic. And that's going to take some time before it gets better. But I guarantee you, for every nurse that you on that particular day, because I refuse to think that's who she is as a person, you may have a not so great experience. There's many nurses where they could have solved your problem. But just think about it. The fact that you went into a pharmacy shows you that there's a shortage of doctors, there's a shortage of pharmacists, because in another world, you wouldn't find a nurse in the pharmacy in the first place. You'll find a pharmacist there. And doctors will do most of the diagnosis, because the nurse is not meant to do diagnosis. They're meant to gather information and provide it to a physician who is trained in the whole body to arrive at a decision point. The same way physicians and nurses should not be doing medication therapy management. You know, when it comes to the pharmacology aspect of it, a pharmacist should be the ones guiding the patients, you know. So our system is fragmented, but also we're strained by lack of a lot of things, you know.
Thank you. It's fragmented, but I believe we can fix it. We will fix it, inshallah. I mean, I'm not sure if my co-host is here, but I think the chat box is a bit busy too. Someone is asking if you could share your contact. Yeah. I believe today. Okay. Someone was asking if he could share his contact. I know that would not be a problem. Probably they would also want to have you service their parents back home.
I respond to I try to at least every single social media page that I'm on. So my LinkedIn, even if I'm late, because I have a team that helps me, my LinkedIn, my Instagram, my Twitter, you could find me, send a message. The fastest way in terms of healthcare is through my team, because I'm going to give you guys an advice, because a lot of you guys are going to be young leaders. If you don't have enough people in your organizations that you trust to be able to delegate that they will provide the same level of care as you would, then you're not building a team. You're building an oligarch situation where you're a dictator, right? So when it comes to healthcare needs, I tell individuals, you would get the care you need much faster by calling my team, which I'll share the information for Innovarx, than you would trying to get a hold of me, because for any given time, even right now, the hour that I spent with you, my WhatsApp, I cannot keep up with it. It's not a good means of communication. So I'll share our numbers of our team. LinkedIn, you could find me. It's 2622-200, and then 2324-224. We're really good with getting information out to you guys. If you're part of a community, especially in the rural areas, we go to communities all the time and offer free screenings as part of our corporate social responsibility. That's something, whatever company you end up doing, always think about something that you're doing because of God, because you're giving it to somebody who otherwise would not have access to it. So if you're part of communities, you're part of local organizations, you could also reach out if you wanted to, you know, organize a community clinic for your hometown. We do it for every single person. My team is actually in Sibanor this whole day, screening people for diabetes and hypertension for no cost. Once again, data, healthcare, information. So yeah, but you could reach out to us 2622 and then 242224.
Thank you very much. Yeah, I'm a living witness. I do follow you on all your social media, and I see how active you are. I could definitely attest to that. Let's move on, because we have still so many questions. I think we need to do a bit faster with this. Let's have Mr. Fati, please. Mr. Mamadou Fati. Over to you.
Thank you very much, Mr. Njai, the moderator, and thank you, Dr. Badjie, for that wonderful explanation, or that wonderful, of course, breakthrough presentation on the topic. So I have a question. One would be directed towards the operation of Innovarx. I've also been following your work pretty much on social media, and of course, friends of mine that work with Innovarx, testimonies of the standards that have been there. So yes, there was a time I also read about the MCA, that is the Medical Control Agency of the Gambia. That was the time I think they temporarily closed the institution. I think citing reasons for importing, I think, that long lasting insulin, something like that. Yeah, so I want to know about those systematic barriers. What are some of the systematic barriers or challenges that institutions like yours faces in the country? Because that will discourage other people that might have similar intentions to go back home and develop. And this does not only happen in the healthcare sector. You look at other areas. If Gambians wants to establish, there are some systematic barriers or policies that are in place that are put forward by the authorities. So what are some of the things, what are some of those systematic barriers, if any, that your institution face? And what do you think is the way forward?
Yeah, I think it's an excellent question. When it comes to the pharmaceutical sector, and you know the biggest tragedy about our incident, Innovarx doesn't do wholesale distribution, right? The only reason we import medications is because we have patients that need medications that we service through our clinical services. That's the biggest misunderstanding. Most people, they compete against us as if we are importers and we're engaged in wholesale distribution. The only reason we even have any exposure to MCA is Innovarx is one of the few companies in Gambia where the owner of the business is a pharmacist. The owner of the license is a pharmacist and a Gambian. And we have a model of healthcare delivery when it comes to medications where we believe in subsidizing medications. We believe in making it affordable. And I'll give you an example. We're the only institution in Gambia where from Banjul to Basse, it costs $300 to get up to 60 tablets of hypertensive medications, diabetes medications delivered to you every single month. And we've been doing that for 5 years. So you come to a point where, because I told you the pharmaceutical sector was regulated, even our laws were designed not to increase quality of medications. It's designed to control who has access to the markets. So the biggest misunderstanding or lack of clarity that people may not have is, unless you intimately understand how the pharmaceutical sector has been run for 30 years before the likes of me came home to offer something different, you'll understand how we ended up where we ended up. That's what I'm gonna say. But I believe that if you are righteous, if you have been doing business the right way for the right reasons, if you find systems that may be broken, persistence and engaging, you cannot change it from the outside, you have to change it from the inside. And that includes our laws that are outdated. So it comes down to that. There are barriers. There's a financial cost to it that I don't think some of the decision makers understand, that if you're business minded, you have shareholders, you have investors who expect return on returns. And for example, because of our MCA issue, our revenue went down by almost 60% compared to 2023. So it was months that we were paying over 100% of our revenue in salary just to make sure people had money. It was months where our staff accepted to take less money just to be able to serve Gambian people because they knew we did not have money. These are some of the stories where I could go through it in another country, and it's their country. It's more painful that I had to go through it in my country, where you would have thought that we were in the business of distribution of Kush or any of the drugs that a lot of young people are battling with. It's just unfortunate. But I believe that eventually things will have to change. So for anybody who's coming to build in any sector, and you're right, Gambia is one of the worst places to do business. And that's one of the reasons, because barriers that are self-inflicted. If you're entering an ecosystem where they see you as young, energetic, they equate it as being a threat. And sometimes they may even do certain things. Yeah, so it's just learning. In business, you're gonna face challenges. It could be financial challenges, regulatory challenges. But the MCA issue just made me realize how deeply entrenched certain things that people just have accepted that it's okay, that it's not okay. And it goes back to Gambia has to work for us. It has nothing to do with anything political. So most people will be quick to say, the government X, Y, and Z. Most people who soar and know the right thing to do will never show up on your ballot box. The everyday Gambians who choose the interests of a non-Gambian over a Gambian. At the end of the day, that's what it comes down to, because it benefits them. So you just learn. So if you're starting a business in Gambia, I tell you, understand your sector very well. Understand who the kingmakers are, understand how the economy works, understand people who would not want you to be in the system. But as long as you provide value, as long as you stay connected to the people, I think the power of the people and the power of your customers will always vindicate that what you have to offer matters. And that's the only reason why, I'm even speaking to you guys today, because our company was going to go out of business last year. And it wouldn't be because we didn't have a problem to solve. It wouldn't be because we didn't have the know-how. It wouldn't be because I was not competent. It would have died because of regulatory issues. And I still wake up some days today and wonder, have to really double down on why I started it in the first place. I hope that gives you a little bit of context.
Inshallah, you shall prosper. It's not easy. We have a question on the chat, but before that, I will allow Abdullah Tarawale, please.
Thank you very much. Thank you very much for giving me the opportunity to witness this amazing presentation of Dr. My question is actually, most Gambians are actually so conservative, and when it comes to accepting the conventional medications, they are very, how to call it, unwilling to go in for it. So I want to know, what exactly the doctor actually thinks is the strategy to put in place in bringing these people into accepting conventional medicine. And I also have just an annex question to the previous question that Mr. Badjie just answered. That question is Gambia actually really ready for accepting development? Is Gambia really ready to accept development? Putting in place this regulatory and stuff like that, is the Gambia really ready for, for change, for development?
Yeah, so to answer your first question, that second question threw me off because it's kind of funny, but not funny. I'll answer your development question first. It really threw me off, and you'll have to ask the first question again because I'll tell you this, right? The premise of that question is wrong. We shouldn't ask ourselves if Gambia is ready for development. We should ask ourselves, how are we going to develop Gambia? And how am I going to contribute to the development of Gambia? Because oftentimes development, like a lot of things, we think somebody needs to come and develop Gambia for us. This association is developing Gambia by making sure I'm having a conversation with you guys on a Saturday afternoon, where the average Gambian would not find this valuable on a Saturday afternoon. Developing Gambia is me making a calculated decision. You know what? I have a finite amount of time. Let me go and build. You don't develop Gambia or any country by receiving. You develop a country by building the hard way, not for you, but for the generations that are coming behind you, right? That is how you develop the Gambia. Telolu, Mirmisutange Betanga, like any other country, will have to sit down in a room, get very uncomfortable, and do it the hard way, because since 1965, we were waiting, thinking it was going to happen miraculously. It's not going to happen. Jesus is not coming back. Prophet Sallallahu Alaihi Wasallam is not coming back to solve it. Even scripture tells us that you have to get up and work. A lot of you guys probably know the Quran way more than I do. If you listen to Alam Nashrah Lak Sadrak, God is telling you, yes, with difficulty comes ease, but he also tells you, as soon as the difficulty is done, get up and work, right? So that's just the mindset we need to have, because our cousins next door, we're seeing change, we're seeing development. It didn't happen by miracle. So yeah, what was your first question again? Because I thought of that second one.
The question was about
the first question was in most cases, Gambian, like the majority of some Gambians, let me just say some Gambians, they are kind of like conservative, because for me, I even see it with some of my parents and some of my family members. You would advise them to go to the hospital, but they will prefer taking this local medicine. So they are so conservative.
I got it. Have you guys ever heard the saying that medicine is an art and not a science? Has anybody heard that before? There's an art to how you perform healthcare. Most people work in binary, 0 or 1. It's not either or, it's and. If my mom really believes that that true root is gonna be what brings her blood pressure down or makes her skin clearer or whatever it is, I cannot deny it, because science has not been done yet, because I think our science community has an opportunity to study our local herbs and traditions to make sure it's safe and effective, because they're valid. All medications come from plants or something that is existing, and then you find a molecule and then you may be able to synthesize it in a lab. It's not either or, it's and, which is why a pharmacist who really understands patient psychology, you meet the person where they are and you find the path of least resistance. So long as what they're taking does not interfere with the treatment, let them take it. Because if it's not harmful, you understand it, right? So that's how you balance the two, because that's why placebo effects. There's certain people that they will swear that if they wake up every single day and drink cold water on a blue cup, that's the reason why they're healthy. You could believe whatever you want to believe in terms of that. But that cold water with a blue cup, take it with your blood pressure medicine, because we want to try to bring this blood pressure down, because we know if we don't, the consequences are great. So you have to understand their psychology, but meet them where they are. A lot of these things, there's nothing wrong with it. If they have a cold, they feel like they want to drink some neem tea or something like that. These are our grandmothers. It worked for them at some point, so there's some merit in that. But I think our generation, your generation of scientists, hopefully will have labs in the Gambia where we're now doing clinical trials. We're validating some of these things, because I guarantee if it works, the whole world will be coming down to buy it from us. And then now we could have a whole pharmaceutical sector based on our natural products, making bitter cola capsules, making baobab capsules with combinations with moringa, because we've done the science and it could be good for certain things. So I think, listen, anything that foreign is not good. I believe there's goodness in us. We just need to refine it. We need to cultivate it. And the moment we have a stamp, then we'll be able to commercialize it. So I'm not against traditional medicine. I only have a problem when they become the reason where treatment is stopped, because patients with jahle, when it gets really, really bad, then they run to the white coats anyways and expect a miracle, right? So I think there's just an art to balancing those things.
Thank you very much. Amina, what do you have on the chat box?
Thank
We
you,
have kept
Mr. Dr. Badjie. We have a question here, and it says, what are the benefits of focusing on primary care and chronic disease management rather than emergency care?
That's an excellent question. It's more expensive and the outcomes are not as good. And that's where the majority is. Goes back to business model, right? Majority of how many 17-year-old Gambians need an emergency room? Every day. Not a lot. It'll be a while before that, unless freak things happen, like a motor vehicle accident, which we have a lot of sort of accidents. That's why they call it the accidents, meaning statistically, it's not a common occurrence. The future, how you build healthcare in a nation, especially a young nation, is you double down on primary care. Because only minority of the reactive minority seek care late. And that's when you spend the most money. So even it costs more money to run an emergency care business than it does a primary care business. That's why even insurance, they don't like insuring people that seek emergency care because it's more expensive. But also, listen, you cannot, no one person could solve the health system in Gambia. Sometimes, what you're really good at, stay in your lane. Innovarx is really good at capturing people as early as possible and keeping them as long as possible. Lolu len mun. Banjul to Basse, we could comfortably and confidently say that we're good with capturing people. And if you have a chronic condition like diabetes and hypertension, we do a really good job of taking care of that demographic of patient, which is why I gave you that number, 366,000 people, because I am chasing that 366,000 people and getting them on treatment plans that involve access to a doctor, access to their basic care, primary care. Somebody else's jihad could be other aspects of the healthcare system. And then we work together, right? Which is why we need more people to have passion with certain things. But my experience in the USA was working in the communities. I understand the primary healthcare system. I've built it. I've managed multi-million-dollar operations in the USA. So that extraction of knowledge, I came home with the knowledge that I had. That's why I have a good relationship with the diaspora, because the diaspora know what I used to do in the USA. So I'm a credible individual to build a business that's not focusing on a 500-bed hospital, which we'll never get into. And most people ask, Innovarx will never own a hospital bed. It's not our business model. But I want to see our motorcycle drivers everywhere in Gambia making sure people's grandmother has access to the right medication. So it's just understanding. But I think there's a lot of prospects, going back to the question. Radiology, there's a huge need. Physiotherapy, there's a huge need. Any place where you feel like this is not okay is an opportunity for you to exist. For everything that you feel like, Gambia doesn't have this that is really good yet, entrepreneurs see that as, oh, then I could create and solve problems. Because yes, we don't have enough radiology services. So Senegal is making a lot of money from Gambia because a lot of things that we don't have, we run to Senegal. So yes, as long as you are passionate about it, if you are a credible individual, you can't rubber healthcare. That's one thing I keep telling people. If it took me 28 years to be a doctor of pharmacy, you are not gonna know how to do what I do just because you think it's nice and you have money. It's impossible, right? Certain professions, you could take shortcuts. That's why us healthcare professionals, we know we didn't take shortcuts. You can't rubber your way into a good healthcare practice. You have to know what you're doing, or you come in partnership with somebody who knows what they're doing. We have a culture sometimes that we reward people that are not, you get rubber, they don't even know what they're doing. And I tell people, yes, we need to support each other as Gambians. Why Gambian you mun? That you want to support. Are you a competent person to offer a service delivery where people that receive it will understand that they're getting value? Then you have a right to exist in the market. And I think that has to be a shift. So I never tell people support Innovarx because we're Gambia. No. Anyone who interacts with Innovarx you will see clearly that our agenda and what we're trying to create, we're offering something different. And we want more competitors, because the more people that try to do it the way we do it, now we have to compete on who's going to make Abdullah happier, who's going to make Padmane happier. That's how economies thrive, when there's healthy competition. Why Abdullah du mëna tej dëkk bi rek ne Ismail du dugg si te mënut, Abdullah mënut, ñëpp xam ne ne mënut te du bàyyi. Xam nga loolu tamit dañ ko war a xalaataat de. You know, just something we need to think about. Right?
Affaire la dëgg is a big issue. I can see we've already 2 hours, and I definitely know you're not paying for this. You could have been at the office by now, but you're here with us. And you know, students, you have time, and we are around 9 to 10 p.m. here. So, but we'll just allow a few more questions. Hands are still up here. Let's have this Mr. Gambian students in India. I believe it's, what is his name again? Sajo.
Yeah, am I audible? Thank you very much, Sanjay, for letting me in. And I would like to say thank you very much to Mr. Badjie for those wonderful insights. Actually, I had 2 questions initially, but then one of them was asked by the other, one of those that asked questions with regards, how do I put it, our parents, or per se, some of us being naive in accepting some of the things. However, my question would go like this: like, in light of like the perception that pharmacy is often viewed as a profit-driven business rather than a healthcare service, just as you were trying to explain here, coupled with concerns raised in documentaries about modern medicines having more like harmful side effects than beneficial outcomes. How do you, like as a pharmacy, address these criticisms? And also, more importantly, like how would you like convince some of us, like the skeptics, some of us that would have some skepticism on how to believe on avoiding modern medicines due to fear of side effects, while reassuring us that the integrity and safety of pharmaceutical practices in the Gambia? Yeah, that's what I have to ask. Thank you.
No, that's such an excellent question. And I think there's a balance to it. And I talked about conscious capitalism. Even a government is a business. That's why we have budgets. How much did we make versus how much we have to spend? You as an individual, you're a business. You should be making profit, meaning your expenditure should not be more than what you're earning. If not, you're going to go in debt. So profit is not a bad thing, because it's the foundation to which you have the opportunity to do more, be it a business, be it you as an individual, your financial goals. So I think there's nothing wrong with it. Any healthcare company, any company, you have to make sure there's a balance to it, meaning what you're getting into run, operate, it has to be more. If not, you're not going to be in business. So I think just that one thing, there's nothing wrong. And somebody who likes profits, we shouldn't shame them as a Gambia. You know, the difference between sometimes people who come to Gambia for economic opportunities is they chase profits. There's nothing wrong with profits. So that part is just like every business has to be profitable if you want to stay in business, unless you are non-profit and somebody's giving you money. But even then, they want to make sure what's coming in and what's going out, there's a fair balance to it. And that's why I think it's very important if people with high moral character become business owners, because it influences every single decision that you make. It influences you having the conscience of what medications you're bringing into the country. You love your Gambian so much that you wouldn't bring it. So we need people of high moral character to be in positions where, yes, you could make profit, but make it with a clear conscience, because we do want people who love profit. Gambians should be millionaires. We have a right to wealth, right? Wealth doesn't happen accidentally. It's small, decisive steps over a very long time, and compound interest yields wealth. That's why anybody who's successful, there's a million steps that happened before the world got to see them. That's one part. Second part, in terms of medications, there's only, in my opinion, only clean water is harmless. Clean water. Everything that you put in your body has positive and potential negative effects. It goes back to you making a calculated decision and weighing the benefits and the risk. Every medication has a profile of side effects, which is why as a professional, you have to have access to somebody to tell you what to expect. Void of that, you're exposing a mass population to consume medications without the knowledge of what it does. There's not a single medication that's ever been in existence that doesn't have a side effect profile. But I'll take myself an example. Lisinopril, some people can't take lisinopril because it causes a cough. It may cause swelling of the lips. Some medications will cause swelling of the feet. It comes with the medication. But also, somebody like me, there's a risk benefit. I take every single day medications, and maybe I manage and control those potential side effects, or my body goes without blood pressure medications, and it is going to end up in stroke. It is going to end up with kidney failure, which is why if you look at clinical trials, how medications come to be, phase 1, you're just testing, not even effectiveness. Is this even just safe, right? Phase 2, before you even come to human beings, put it in a rat or a pig before you come to the top of the food chain. So you've analyzed the safety and effect, and then you put it in human beings in terms of phase 3 clinical trials, where now you're testing it across a large number sample set of patients, which is why anybody who's part of the study who says that, I had a headache, I had diarrhea, even if that medications get approved and the diarrhea was probably because you ate eber that was really bad, that you didn't have any problem, or anything that you didn't have, as long as you were taking the medications, you have to report it as the side effect profile. That's why the consumers now need to know that, hey, it's possible that if you take lisinopril, for example, it may cause this. That's the knowledge that we have. And that's the difference between somebody who's a doctor of pharmacy, because we understand that all these medications, there's no such thing as a medication that doesn't do anything. Sometimes you'll even rather suffer with the side effects because you're trying to give yourself a chance of living longer. Some of the antibiotics are terrible, but you don't want to stay with the alternative. So there's a risk-benefit analysis to it. And it goes back to just having the right people at the position where sometimes the best prescription, for example, is go and lose some weight, stop eating sugar, do certain things that you could control, and you could delay. You may not be able to prevent, but a prescription is not medication. It's one of the biggest misconceptions. The root word of prescription is solution. So the chemists back in the day, if you come with X, Y, and Z, the concoction that they create was a suggested solution to the problem. That's the root word of a prescription. It's not synonymous with medicine. So I think it's just having a holistic approach to healthcare, and it allows you to work that tightrope without, obviously having a right to make profit, but also putting patient interests at heart.
Thank you. Thank you very much. Let's have Model Louis now. Please, I think we are running out of time already. You can see we already.
Yes.
I think if the question was answered. Yeah, let's have Model Louis, please.
Assalamu alaikum. Greetings to everyone.
Alaikum salam.
Sanjay, this was looking like a payback day because I was the third person to raise my hand. Okay.
No.
Actually, I'm a fan of Mr. Badjie because I have a sister working with him. But anyway, my question is, actually, this happens to me a lot. Like the moment I'm sick and I'm given medication, once I take the medication till like I feel a little better or I'm better, I will not finish the medication because I'll be like, wirna, jaruma ko jakadesa. So I'm asking, is there any problem with not finishing the dose, like the specific dose given to you by a doctor?
Yeah, yes. You know what's going to happen? People thought COVID was bad. The next global crisis is going to be antibiotic resistance because of that behavior. Because let me tell you how bugs are. Human beings work on survival. So do every animal, any organism. Antibiotic resistance is going to happen in the next 20 years where antibiotics are going to stop working. It's already started. Because if you take medication that's supposed to be for 7 days, it takes some antibiotics. If some people, I'm going to get very technical. Some antibiotics work by how long is it present in your body to kill the organism. To make it like this organism is going to live for 7 days, Balamorde, before the organism goes away. The moment you take it for 3 days and you stop, not only does the organism survive, the same way you have memory cells, it now understands that that medication almost killed me. Let me start re-engineering this defense mechanism. That way, when I see it again, it won't work. That's how it affects, especially short-term doses, things that you need to take it. On the flip side, you become a time bomb. If it's a condition, so you know healthcare, it's either acute or chronic. Acute is malaria, you know, take 3 days, 4 days, you take the medications, hopefully you finish it, and it's done. Chronic is diabetes, hypertension, it's never gonna go away. So me not taking my blood pressure for 2 days because, you know, it's December or January, there's a lot of activities, I forgot, or I ran out of medication, or I don't have money. All the days that I don't have medicine, your blood pressure is doing this. Whether you know it or not, it's increasing, right? So that's how it affects. So it becomes a decision. That's why it's so good to have a relationship with a pharmacist who start with why. Most people take medicine and they don't know why. They don't even know how the medication works. And as a patient, always ask the person giving you the medication, how is this medication gonna work? That's how you know if somebody's fit to sell you medication or not. Is it gonna affect your kidneys? Is it gonna affect your liver? How long is it gonna last in your system? How many days should you take it? What happens when you take it with milk? There's certain antibiotics that the moment you take it with milk, the antibiotic stops working because calcium just literally holds on to the antibiotic and stops it from working. Do you think the average person selling medications knows that? They don't. What a ham, that's important. It's so important when it comes to medication information. Every single medication that I see, I know the benefits and the potential side effects. So when I'm speaking to you as a patient, I'm telling you, you need to take this medication for 7 days straight because if you stop it early, there'll come a day where you will need this antibiotic to fight this infection and it's not going to work. So I hope that answers your question. And based on your last name, I think I know who the person who works for our company as well.
Yeah.
But that's the reason why it's so important. That's why don't ever take medications from a friend that is meant for that friend, because you also don't know if you have an allergic reaction. Certain medications could literally stop your heart because you're not supposed to take it, right? It is literally lethal. Medication is not safe. It's only safe if it's for the right patient, for the right condition, for the right time. That's when it's safe. It's not always safe. It's not always effective. That we know. So I hope that answers your question. But it's something that we really struggle with as a society.
Thank you.
It does. Thank you very much.
Thank you very much. Amanda, before we take the last one, I'll just allow Moses that was in. I believe he's a pharmacy student. Moses?
Yeah, last question for the pharmacy student.
Yes,
I have
exactly.
another engagement.
Exactly. That's what I am saying. I also
Yeah.
want to go on. It's very to keep you so long. Moses, please.
Okay. Good evening, Dr. Badjie and everyone. Thank you so much, Dr. Badjie, for your valuable insights. Yeah, this session has been truly informative and enriching. So if I heard well, you talked about the possibility of patients having doubts while administering drugs. And just not long ago, Sergio also spoke about some criticisms faced by pharmacists and the likes. So going further, how can we improve access to essential medicines and healthcare services, particularly in rural areas, addressing the prevalent healthcare disparities and complaints? And my second question is, looking at Innovarx, you have nutritionists and many other healthcare professionals. So what opportunities are there for collaboration between pharmacists, other healthcare professionals, and stakeholders to improve healthcare outcomes in the Gambia? Thank you.
You know, that's excellent. I think it's an excellent question to put a bow on the conversation as well. So in terms of the first question, I think we have a numbers problem. Gambia still doesn't have more than 50 pharmacists. Our population is 2.5 million people. It's impossible for pharmacists to be everywhere, right? And most people also don't realize it, or sometimes they do. We don't have more than 50 pharmacists in the country, right? Which is why sometimes nurses will ask, so one, we need more pharmacists. We need to double the pharmacists. Like we need 10 times the amount of pharmacists, 20 times the amount of pharmacists. But in this day and age, wherever you have a shortage of healthcare professionals, you leverage technology. you leverage virtual care, you leverage last mile delivery. And honestly, Innovarx is a good case. I'm not speaking about it just because, you know, it's our company, but that's why from day one, we started serving Banjul to Basse, because we knew you could put wellness on wheels, literally, and meet people where they are, which is why wellness on wheels exists in the Gambia. And in this day and age, most people have a smartphone. And if they have a smartphone, they should have access to healthcare. If they have a smartphone, they should have access to a pharmacist. So we just have to get very creative while we encourage people like yourself to join the profession for the right reason. And then, you know, you'll also be passionate. We'll get to a critical mass 30 years down the line where there may be 1,000 pharmacists in all the states and regions. Development will happen across the country, where now every new place that's development is happening, there'll be incentives for people to open pharmacies, and there'll be more pharmacists in the country. So Gambia is just early. It's young, it's early, but wherever there's a gap, you could use technology to fill the gap, which we're doing a lot of virtual care stuff with our upcountry patients. We're using motorcycle vehicles to get, you know, deliveries done every single month in parts of Gambia that I've never been to. My drivers know. So yeah, it's just a combination of those two.
Wow, thank you very much. It was Abdullah and Aminata driving you through. And that brings us down to the end of this tonight. So I would now invite the academic secretary to give the concluding remark, unless if you have anything to say, Mr. Badjie.
No, just a thank you. Just a thank you for the opportunity for the conversation. No matter how many people were here, what we talked about is something we should continue talking about. Find your why, align yourself with something that is bigger than you, lose yourself in the service of other people. Just serve, make the world a better place. And I think you guys will be in good hands.
Thank you very much. I'm really apologizing to Mr. Ibrahim and some of the messages that are on the chat, but definitely we had kept this doctor for almost 2 hours plus. So we definitely would want to apologize and call the academic secretary to give the concluding remark or closing. Thank you.
Okay, thank you very much, Ms. Njai. Okay, thank you very much, Ms. Njai. Good afternoon, Mr. Badjie, and good evening to you all here in India. As we come to the end of today's insightful webinar, am I audible, Ms. Njai?
Yes, please.
Yes, you are.
Thank you. As we come to the end of today's insightful webinar on this topic, this very, very important topic, on behalf of the 8th Executive Council and the General Student Body of Gambian students in India, we want to extend our heartfelt gratitude to Dr. Ismail Badjie